Hello, and welcome to another episode of Cutting Edge Health. Today, we're talking about the best potential IV therapies for pain relief. And I am incredibly excited coming from an anesthesiology background because it's what we do as our basis. So when we talk about being able to help someone using IV therapy, it's what we do. So totally excited to talk to you about different types of therapies and start looking at that with the scientific basis behind it. We're going to cover a number of different topics in regards to IV therapies, everything from traditional treatments, things like ketamine and lidocaine, to us talking about some things that are a little bit more obscure, like bisphosphonates, and then us talking about vitamin type treatments, things like vitamin C and magnesium and such. So we really want to kind of give you the gamut and then do a summarized version of what might be better than others based off of what the science shows, not just what we feel it is. So as we get into the context of talking about the elements of IV therapies first, for those of you who haven't had an IV, we need to kind of define really what that means. So it looks a little like this. So if you're taking a look at a needle that's going down, if you were to kind of go straight through everything, it'd be an intramuscular injection. For those of you who are squeamish, just hold with me for a little bit. It won't be that bad. We're going to get through this pretty quickly, but just so we're all on the same page. Subcutaneous is you're underneath that area of the skin, and intravenous is we're actually in the vein. And that's what we're talking about, which is different than intradermal or other things along those lines. So what we're talking about is being inside the vein and delivering fluids accordingly. For those of you who join us every week, really appreciate your support and are so happy to have you with us today. So as we took a look through different articles and wanted to find resources, one of the things that we looked at was one particular site that actually represents pain patients. It's called Pain News Network. And one of the things that they talk about is 4 infusions that can help relieve chronic pain. There's a lot of different things that are out there, but the ones that they talk about are actually kind of varied in nature. They talk about ketamine, but then they also make mention of things like stem cell IV infusions, which is not going to be something that we discuss. We talk about regenerative medicine in other contexts, but I'm willing to have that conversation if people have questions and why we do regen in one way and why other people think about regenerative medicine in a different way. But what we're talking about is kind of tried and true utilization of treatment options that have been around for a period of time. So one of the most common ways to be able to look at treatments are the following. So kind of top 4, if you would. Ketamine, lidocaine, propofol, magnesium sulfate. Those things have been out within the construct of anesthesiologists for pain relief for quite some time. Infusions have been used probably since maybe even the mid-'80s or so, excluding propofol. However, some of those things have science behind them and some of them don't. And so that's what we're going to talk about as we kind of get into the discussion. So what you'll see is a lot of IV therapies, particularly for headaches, that can be able to give relief because that person comes in, they're treated, and then they're bolused, and you can be able to get an acute response faster than what you might otherwise would with the utilization of an oral. So we're going to talk a little bit about headaches very briefly, but then we're going to look broader than that. So you take a look at the IV treatment for centralized pain and headache, right? So different articles that we're going to kind of cover and kind of get into and have a quick conversation about. But what we really want to be able to do is to kind of even look even broader than that. So this is kind of a Sentinel article, that's called the Intravenous Infusions and Chronic Pain Management. It was put out a number of years or so ago, almost close to maybe a decade or so, but it really helped formulate thoughts about how can we be able to improve different types of pain conditions. So as a viewer, what you probably want to say is like, well, what will this help me with? How is this going to benefit me? What type of pain would you have that an IV therapy might benefit outside of headaches? So one of the things that you could consider for utilization is going to be something like fibromyalgia or myofascial type states, so meaning muscular in nature, neuropathic pain, so that nerve burning, tingling type sensation, particularly small fiber nerve type issues, phantom limb pain. And so what phantom limb is, and we've covered this in other talks, but basically it's pain that occurs after a limb has been amputated and you still have remaining pain that's present. It can be able to be helpful for postherpetic neuralgia. So for those people who have something like shingles and that shingles goes away, you can see that pain being prominent and being nerve in relation. And then you have things like complex regional pain syndrome and diabetic neuropathy and central pain, which all have an element of neuropathic pieces to it. So that's what we're going to kind of discuss a little bit and kind of get into it. So Things that we may mention of before are lidocaine, ketamine. We're going to talk a little bit about dexametamidine, not so much about phentolamine, and something about bisphosphonates. Right off the bat, most people will say, it might help me, but what are some of the side effects that can occur? So I'm going to give you that kind of disclaimer that everyone wants to know, but it may not necessarily impact them. So if we take a look at lidocaine, we can tell that it can predispose one to seizures depending on whether you take a look at certain things. Somnolence, meaning sleepiness and confusion. Ketamine can increase your heart rate and cause you to have some hallucinations, most of which can be abated. Phentolamine can cause you to have decrease in blood pressure and changes in heart rate. Dexametamedene can cause a decrease in blood pressure and a decrease in heart rate. And bisphosphonates can cause you to have kind of flu-type symptoms, right? So those type of things all have potentially their side effects, but most of them don't present to patients. So let's get right off to the very start with kind of the granddaddy of them all that's really kind of kicking butt and taking names right now, and that's ketamine. Look at ketamine. This is that pharmacologic structure. When we talk about what does ketamine do, in essence, it is a substance that impacts the cytatory amino acid glutamate, but most specifically, it really targets something that's called the NMDA receptor. And there are other mechanisms of action, but in short, as we kind of breeze through this, that's the element of how ketamine works. And it works in differing fashions for different things, whether we're talking about depression or whether we're talking about pain. In this context, we're talking about pain. We're going to come back to, is it really useful or is it not? What do the studies show? Next up is lidocaine. So lidocaine is an old school drug that's been used mainly for numbing, and we are pretty familiar with it. Patients will say, you know what, hey, before you do anything to me, give me some lidocaine. It'll make it a little bit more numb. So how does it work in an infusion style? In essence, it blocks sodium channels. And in blocking sodium channels, what it does is it prevents the propagation of nerves with the aspect of their action potential. We're going to look at another medication, dexametamidine, that has a similar path, but does it in a different way. In addition, we're going to talk a little bit about bisphosphonates, which you really don't hear all that much about. And we're really kind of curious, how does this impact pain? So bisphosphonates are drugs that are used mainly for osteoporosis. But one of the things that has been seen is that bone pain can actually be interrelated with nerve pain, and the periosteum, which is the outside of the bone, and bone marrow, which is the deeper portion, is highly innervated. And those structures can cause release of inflammatory cytokines, which are molecules that can cause a pathway of upregulation and inflammation and pain. So when we talk about looking at bisphosphonates, the pathway looks a little like this. So historically, you have something that's called osteoclasts, which break down bone, and in doing so, they can cause a peripheral sensory nerve issue that can occur. And it results in all these different things that can pop up, like tumor necrosis factor alpha, PGE2, IL-1B, fancy names for a lot of different things, but in essence, they cause inflammation and potentially resulting pain. Bisphosphonates break, or rather prevent, that cycle from occurring by stopping that osteoclastic type activity, which can be able to improve pain in a number of different ways. As mentioned before, we talked about dexametamidine. In essence, it's a type of medication that is used for sedation, but what has been looked at is its value in terms of being able to provide pain relief. Most of it has been within acute settings, but there is some thought process of whether it can provide value in the chronic setting. So dexametamidine, it actually has an alpha-2 adrenergic component, which is similar to a medication called clonidine, but it has a much more prominent selectivity. So if you can see it, maybe that fourth line, dexametamidine is 1620 to 1, while clonidine is 201. And it makes for a difference in terms of how sedation and analgesia is present. I know I'm talking with a lot of fancy words, and so I have people kind of drop it off already, but bear with me. I want you to really kind of understand that we're giving you some insight about what these different molecules are, so then we can come back and sort of rank them in terms of what makes sense, both based off of the science as well as their kind of risks that are associated with it. So we're going to break it down, and I'm going to explain it to you like I'm 5 years old. And I'm going to explain it so that everyone can be able to understand. But we're just trying to kind of tread through some of the various different types of drugs that make an impact for pain relief. Okay? So as we were talking about that component of dexametamidine, it has that alpha-2 component that's present to it. And there's different mechanisms behind how we believe it works for pain. But in essence, as I alluded to when we talked about the utilization of lidocaine, is that it impacts how nerves transmit their signals. And in essence, what it does is it prevents that nerve transmission by acting at the synaptic cleft so that it decreases that neurotransmitter from being present. So why are we talking about all of this? Because imagine if we could be able to improve pain without having to necessarily use a traditional intervention, like for instance, spinal cord stimulation or an epidural steroid injection or opioids, or we may be able to diminish either of those two utilizations. That's why we're talking about why this might be able to be of value. Continuing that dexametamidine theme, most of the studies that have been looked at to be able to evaluate it has, as I had mentioned before, been in the perioperative period, meaning so in and around surgery. And what they've seen is that sometimes it improves pain and sometimes it doesn't. So if we're rating dexametamidine just kind of at its offset, like just evaluating it, it's not a number one. It's not a number two. It's not even a number three. I think there are other things that are way more useful than dexametamidine, but it shows some promise. So when we take a look at different treatments that are in place, ketamine has probably some of the most studied literature. And you can see there are different types of pain states that ketamine has been instrumental in terms of providing relief. It can provide relief for central neuropathic pain. So what is that? Central neuropathic pain, as we talked about once before, is pain that's mediated from issues that can occur from the brain, where you have a stroke and you have pain that's occurring because of that, right? When we take a look at things like peripheral neuropathic pain, that could be something like diabetic peripheral neuropathy, where you have issues with the nerve. And we can see, as we take a look at both of those two structures, that ketamine has been better than placebo in a number of different studies. The challenges and issues with the studies that we're looking at for this sort of review and meta-analysis is that it's not robust numbers. So meaning sometimes making an inference, a judgment based off of the numbers that you have, you really want to have a broad range so you can see, does this really make sense for most people or does it not? But ketamine as a whole seems to have probably one of the most robust understandings and support for it providing value. In addition to that, it's been utilized to be able to help improve pain for postherpetic neuralgia, as we talked before, that pain after shingles injury, complex regional pain syndrome, fibromyalgia, and even cancer pain. And for the vast majority, this has been proven to be greater than placebo. Now, there has been a seminal paper that looked at the consensus from a number of different pain organizations that have looked at ketamine, and they actually stated that ketamine as a whole may not be as great as what people consider, but when we rank it compared to other IV therapies, I can tell you, at least from what it seems, it's coming out number one, right? So then we take a look at other things that are out there, things like bisphosphonates, as we mentioned before. When it's compared to placebo, or meaning things that are not really an effective drug, it seems to have some value that's in place. So that's, again, that treatment option that is utilized for that bone issue where you have that bone breakdown. Are bisphosphonates used with a historic utilization for pain relief? Not so much, but there may be a premise to consider utilizing it going forward in the future. So what are some of the other things that are commonly used for pain, both somatically, meaning the body, and also for migraine? And so one of those is actually magnesium. When we take a look at magnesium, it historically has been touted as either a treatment by itself or kind of like a Robin to the Batman, for those of you who are into DC versus Marvel, whatever. As we know, there's a new Batman movie, but that's neither here nor there. But basically, it's kind of like that Robin type character. What we've seen is that there's been a number of different studies that have looked at, is this really a powerful treatment option, or is it kind of so-so? So there's a paper like this that looks at magnesium and fibromyalgia. It evaluated it over a course of different dynamics. There's other papers that looked at the utilization of magnesium for the treatment of chronic pain. And what we really found is the following, is that when we take a look and we can see it over here, magnesium levels and whether it made an impact, no difference, no difference, no difference, not significant, not significant. So what we would say is that as a medication, in terms of trying to improve pain, it can be helpful in certain subsets, so things like headache. But as a whole, it's really not as powerful by itself. It needs to be typically used in conjunction with something else. One of the things that we want to do on our channel is to definitely bring you newer type therapies, things that you may not have heard of. And one of those is actually IVIG. It really isn't that new. It's been out for a while. So what does IVIG stand for? It stands for intravenous, or rather, immunoglobulin, right? So intravenous immunoglobulin. And so what has been looked at is whether it can have impacts on neuropathic pain. And there's been a number of studies that have evaluated this, where they've seen that it's had impacts on complex regional pain syndrome, diabetic neuropathy, postherpetic neuralgia, trigeminal neuralgia. And what they have found is that for the most part, there's not a lot of side effects that are associated with it, which is one of the good things. When we compare it and we contrast it to the things like mentioned before, like bisphosphonates and probably ketamine that's preceding and leading the race, it's not quite that good. And so what we see in terms of taking a look at the studies is the following. So there are a number of studies that looked at IVIG infusion, and what they're able to see is that the pain relief can be a bit limited. It doesn't necessarily last a long time. And more importantly, is that the amount of pain reduction isn't significantly great. So as you can see, for instance, this study that looked at a VAS or a pain score of 5.3, it was able to take it down to 4.2, or 4.5 and was able to take it down to 2.9, or others that had kind of no significant effect. When you take a look at the aspect of IVIG, it doesn't always have the most prominent utilization. It's really specific for different neuropathic issues that may not be as likely to prop up, but it does have its utilization. So let's go a different route. Let's talk about some things like vitamins and vitamin infusions. If you could take a look at kind of the small print on this, this is from 10 years ago, in August of 2012. And one of the things that they talked about is, can the utilization of vitamins be able to improve pain? We've talked on multiple different videos about the utilization of food and how food can be impactful for pain, as well as other things like behavioral health. But one of the things that has been really looked at is, are certain things potentially impactful, like vitamin C or other things along those lines? So when we look at vitamin C, can it potentially provide some pain relief? Surprisingly enough, there are studies that are out there that have looked at this. And so they've looked at not oral, so not meaning pill form, but intravenous administration of vitamin C. I'm curious how many of you might have heard of that before. If so, leave a comment in the chat and tell me whether you've heard of IV vitamin C or not. But be that as it may, when we take a look at this IV vitamin C, it was looked at for herpetic pain and postherpetic neuralgia. Again, that pain that kind of comes from shingles afterwards, right? And what we saw is the following, is that the acute, meaning the early component of pain that presents, it really wasn't all that effective. However, for pain that was present for a longer period of time, is that vitamin C may actually be useful. So one of the graphs that sort of represents that is the following. And that is, you can see this pain score that was in place, and you can see the elements of this week 2, week 4, week 8, and how it starts to separate, where the vitamin is the blue and the control or placebo is the red. And you can start to see that there's a bit of a difference that's in place. So it is a possibility that vitamin C may provide some degree of benefit. The question that has been looked at in that paper and others is how great of a benefit. But at the end of the day, when we compare that to other medications that have more prominent side effects, vitamin C done correctly in an IV formulation doesn't have as many problems as what you might have with some other medications. So I think that there's value that's present. For those of you who have followed us, you know that we actually did a video that looked at why pain and why now. And this video actually took a look at a study that looked at imbalances of vitamins, right? And this paper is the following. It's an analysis of biomarkers in patients with chronic pain. In essence, it was the deficiencies that occur. If you haven't seen it, check it out. But basically, it talked about looking at different biomarkers or elements that are present within the urine to say, could this particularly be indicative or causing pain to be present? And can we modify this from a diet? What we saw is the following, is that you have these biomarkers on the left with a whole bunch of fancy different names, right? And they impact things on the right, right? So as I told you, we're going to kind of break this down. It can impact nerve problems. It can impact inflammation. It can impact oxidative stress. It can impact neurotransmitters, right? And these things can come from different foods that we either intake or don't intake as much as what we should. So when this paper looked at about 13,000 patients that had chronic pain, and 77% had at least some abnormal biomarker, the vast majority being the following. So what we found is, if you could take a look, you can see that these two, quinolonic acid and kyurenic acid, which actually are affiliated with inflammation and pro-inflammatory cytokines. So what does that mean in English? What that means is it causes inflammation, and it causes that inflammation to result in a cascade or pathway of pain, right? And those different imbalances have major impacts. So how can we avoid that? Well, there's a study or rather more of a paper that has recommendations from the International Association of the Study of Pain, which is a pretty prominent organization, that looked at nutrition and chronic pain. We're having an overlay of the aspect of IV versus traditional diet, right? And in essence, what we're saying is that maybe diet can fill some of these needs, but if you're looking to fill it faster, perhaps IV might be useful. So one of the recommendations from a diet standpoint is the following. So in order to be able to prevent vitamin and mineral deficiencies, the things that you probably really need to be looking at are the following vitamins: vitamin D, vitamin B12. We can see magnesium pop back up again, right? And there are different things that you can do for that. So for vitamin B12, you're talking about meat and dairy. And although we know that dairy can have inflammatory elements from having looked at food and nutrition and pain, there may be some utility to that for certain people. When we talk about vitamin D, we can say that certain aspects of fish and green leafy vegetables and whole grains are present, particularly for magnesium. And when we talk about vitamin D in another context, that the sun can be able to provide a source, right? So we definitely want to look at those elements, but sometimes it might need to be supplemented. And so when we supplement, does it provide value? So there's a pretty famous and common utilization IV therapy that's called the Myers cocktail. And for those of you who haven't heard it, we're going to explain to you what's contained within it. It's not normally used in traditional allopathic, or if you were to go to your normal primary care internal medicine doctor, they more than likely wouldn't give this to you. However, if you went to quote unquote an IV bar or infusion center, they very well may. And so what you'll see in most Myers formulas, not representative of all, is the following. Is you'll see a mix on the right-hand side and then continue down on the left-hand side, a mix of magnesium chloride, calcium gluconate, the utilization of other things like beta and beta complexes and thiamine and vitamin C. And you can see that mixed into the elements of sterile water. And the question is this has been touted as being able to provide some degree of pain relief. When we look at the study, did it really come out to be that way? And what we found is probably not so much. Maybe a little bit of benefit, but it's really hard to kind of tease it out. And so the one thing that I would say about these micronutrient injections, these micronutrient cocktails, is they normally don't hurt you. The question is do they provide value? And I think that really is going to be based off of, did you test and did you find a deficiency that was in place that these things are helping to be able to deal with or combat? So conclusion of that study was, in essence, most subjects experienced relief as compared to baseline, but there wasn't a statistical significant difference. So then let's talk about some other pieces that look at vitamin B12. What we've seen for vitamin B12 is that it's incredibly helpful for peripheral neuropathic pain. So if you have a low level of vitamin B12, getting it replaced and replenished can result in improved pain by a considerable amount. And so if we were really looking at vitamin B12 in relationship to our other treatments, I'd probably rank it at easily maybe a number 2 or number 3, depending on the context of what's going on, and most importantly, whether you have a deficiency. So there's a number of different articles that have really looked at this, 24 articles, and they've really been able to kind of see and compare. And basically what they found is that there's some evidence for therapeutic effect for a number of different treatment options. And it's level 2, level 3. So it's not level 1, but it's pretty significant in terms of the benefit that's present there. Another studies that have looked at vitamin B12 and what that actually entails, which is one of the things that's looked at in that test that I mentioned earlier. And when we talk about how well it's improved pain, it's been able to decrease pain by 60%, 23%, 54%, 87% in a number of different studies where they've seen deficiencies. So at the end of the day, what we'd say from vitamin B12 is that it really seems to be able to provide a fair amount of impact. So if we're talking about vitamins as a whole, vitamin B12, vitamin C, and vitamin D can certainly be able to provide relief. And if we're characterizing these different mixtures thereof, of kind of ranking them as we talked about before, as we sort of kind of put this all collectively together, what I'd probably say is ketamine has its value, but there are times when it's not going to be as of use. Lidocaine has its value as well, probably ranked maybe a number 3 or so. Vitamin B12 in the right context, if you have a deficiency, probably falls in at number 2. And then the rest really kind of fall in a lot closer together, right? So if we're saying we're looking at magnesium, or we're looking at bisphosphonates, or we're looking at Ivig, they have specific instances where there's value, but across the board, they don't have a major impact as much as what some of these other substances do. So when we talk about intravenous therapy, I think it really has to be targeted, it has to be directed. And ideally, if we're excluding those that function on the broader things like NMDA or decreasing neurotransmitter release, we really want to know, is there a deficiency? And then can this molecule we're giving potentially address it? So hopefully you found some value out of this video. If you did, please hit the like button. If you think it might be of value for those that you're close to, please share it with someone. And if you think you might want to know about more content like this, hit the subscribe button on whatever channel you're on. And hopefully we can be able to continue to give you more value. I always appreciate you joining us. Have a great day.